It is COVID-19 data from the City of Toronto that advocates have been calling for months. And today, updated numbers were presented to the Board of Health that show a stark contrast in case counts between those living in lower and higher income households. Toronto Public Health has now come up with one solution: isolation centres. With the most comprehensive numbers we've seen so far, there is now irrefutable evidence that COVID-19 is disproportionately hurting the city's most vulnerable populations. In lower income groups, the rate of infection is almost 5 times higher compared to those in higher income groups. A similar trend can be seen in hospitalization rates.
Our most vulnerable populations have been our #1 priority during the course of the pandemic.
Today, the Toronto Board of Health unanimously approved a recommendation calling on all 3 levels of government to create voluntary accommodation options in the city for people who test positive for the virus but are unable to isolate at home.
So that they can actually effect a good isolation, not make their other household members sick, and recover.
The idea, to establish a hotel-like facility so people who test positive and are living in small households with lots of other family members can effectively isolate.
From a public health perspective, when would you like to see these open, not when they will open?
So we would like to see them right away.
Toronto's top doctor says while new case counts have been relatively low lately, they're anticipating surges in the coming months, especially in the fall when temperatures begin to drop, more people suffer from respiratory issues, and spend more time together indoors.
We should expect to see increased activity as people retreat into the indoors given colder weather.
The city has also found significant racialized disparities. For instance, in areas of the city with high COVID-19 case rates, 18% of the population identify as Black, whereas in areas with low case rates, that number is down to just 5%. Dr. Davila also announced today that they are looking at scaling back some of their daily updates, moving to 3 times a week so that her and her team have more time to analyze some of those numbers and trends.